Next popover is the system analytics team. And this is a very talented and quite a large team, as you can see, of analysts led by Floyd Robinson. Unfortunately, he is unable to be with us today. And although I know I'm not the next best thing, I'm going to be standing in his shoes for you today. The analytics team provide a wide range of analysis and reporting functions. They do regular reporting, lots of ad hoc requests. They do data preparation, adding value to the patient activity data that comes out of the data collections. They may create some new data elements. Certainly, as you probably heard from Michael and that, there's a lot of calculation going on there and adjustments. They produce some excellent infographics and dashboards, and they rely very heavily upon the integrity of the data. And they do refer to the patient activity data business rules so that they can have confidence in the data that's being collected, that it is the same across health services, because they're putting out reports for the whole of health. So in essence, as Floyd says, we want the confidence in knowing that we're comparing apples and apples. This is one of the infographics produced for the Health Minister. So everybody out there that's maybe at the coalface collecting this data for us, you can know that when you see the Minister or the Premier at a press conference, that you were at the source of this. These infographics provide very good pictorial snapshot of what's happening in our health services. And it's pretty easy to read, and it's quickly refer to some stats and some information on a range of metrics here regarding our emergency department attendances. And as we know, it's a pretty hot topic that the Minister wants to be on top of, yeah? This shows us what happened in the month of May, and it also, they include some annual stats there for the Minister to refer to. For example, in our emergency departments in May, there were around 88,000 attendances, and around 25% of those were subsequently admitted. 60% of our patients were admitted or discharged from the ED within 4 hours. And you can see in that little wheat attendances graph that it has dropped a little bit since its pre-COVID level of 80%. Interestingly enough, 14% of attendance to our emergency department were potentially unnecessary and could have been managed perhaps by a GP service. And a good one to see there is that WA leads the way in the emergency access targets. This next infographic provides us with a snapshot of inpatient services during May, and you can see there were almost 50,000 admissions, so that's about 1,500 per day, and just over 50% of that activity is same-day cases, which obviously they're going to appear as you see in those top 5 reasons for admission. The average length of stay, though, for an overnight multi-day stay is 5.5 days. Note also here you can see the annual data for the Minister have on hand, such as the annual budget estimates, where there have been increases and decreases in the rate of admissions for chronic conditions. There is information on the waiting list there, for example, 80% of cases on the wait list within the recommended time. And you can also see trending on the waitlist over time. If you look down the bottom left there, you can see that little dip and in elective surgery due to our COVID response. I think this was mentioned earlier when we were talking about our ED data collection and how the information has been used to inform the Mental Health Commission. This is a dashboard which provides you with a broad range of information, stats on inpatient activity, bed capacity, length of stay, waiting time for referrals and so forth. So this is a fairly recent dashboard that is evolving and quite useful for the Mental Health Commission and people working in mental health. Of course, a presentation wouldn't be complete without a COVID dashboard, and some of you will be familiar with this one. What's really interesting about this is it's demonstrating how we are linking different sources of data. So we're looking at our patient activity data here, but we're also linking that into all of the pathology testing as well. And so the pathology testing has been a very important source of data in developing information for our COVID-19 response. Of course, all of that data flying around will lead to a few questions, which leads me nicely to how we often receive questions from Parliament or ministers in Parliament. And where there is a whole of health question, it is managed by the department here. Now, this question might be ad hoc, or it might be like what we call it on notice, a little bit more time. We are always on standby here when Parliament is sitting, as there could be an answer required that day, it could be even within an hour. So responses for these requests are always treated as if they were due yesterday. We need to coordinate several people in responding, including collating data and information across WA Health. So we may be also contacting health services to coordinate that. We have to be really mindful to address the question. It's important that we don't go off track and start embellishing information. So what might happen next is we might gather more information because there usually is a follow-up question which asks us to dig a little bit deeper into the data. This is just a little example of a parliamentary question that we have, and as you can see, it's a question on notice. It was made in Parliament to Minister Health and asking us about how many presentations there were to hospital with this condition over a period of time. The majority of questions we get, parliamentary questions, are sourced from the patient activity data. So you can see that the data usage goes up quite high level into Parliament. Obviously, an artefact of looking at data and using data is you're going to observe variations in it, and as we mentioned with Ian there. During analysis, we may notice something in the data that just looks a little bit out of the ordinary. It might be an unusual increase or a decrease. There could be a really significant variation between one or another hospital for the same thing. And we really do need to investigate these so that we can explain why. And we need to ensure there are no issues with how the data is being recorded or how we're being analysing it. For example, if the emergency department dashboard was showing a performance target met for 98%, but at all the other similar hospitals it was 60%, that might be some sort of special cause variation that we would want to investigate, because the minister might ask us, why is that different? We're going to be able to answer him. He may assume it's correct and he might use the minister's not here anymore, might use that information incorrectly. So in, I guess, providing statements to the public or making decisions. So it would be terribly embarrassing if that happened and we found out that that data was wrong. Just quickly, trending, there's some hot topics at the moment. We're doing a lot of analytics and providing dashboards around flu and winter flu. We are assisting in performance management by providing reports and helping users understand, the front and the back end of all of where this data comes from and how we create these indicators and how it's measured. And so this could help them perhaps replicate that in their own business intelligence team, or at least they can understand it better and can go and investigate it. The patient activity data policy rules and the data dictionaries are really integral to our work, and the data we use provides information to very high level decision makers. It is essential that we record activity that is a true record, I guess, of what actually happened to our patients. Now, I know I don't have any questions. So, just one. Okay. We don't have any questions. We haven't received any questions on this presentation. Does anybody have any questions? Well, I'm sure that if you do have any questions about the role of the system analytics team, you can contact them on the email there provided in the closing slide.